Because of the increased number of diarrhea cases that we see in the hospital, we see it's very important to do latrines and water in these camps because we want to prevent more cases of diarrhea and possible an outbreak. The problem is that we still have overcrowding in DMJ. So increased number of people is already a congested town, so we are posing a problem of if we are not preventing outbreaks, then it could be a disaster.
There was actually no clean water in this whole town. There was distribution of water, but it came from dirty tanks, so it's actually not potable water. So we decided to try to purify at least, to get at least the plant operating again to emergency standards. We isolated one part of this water plant, started with one sedimentation tank, trying to clear up the water. And as a result, we now decrease turbidity that much that it is actually suitable for chlorination. So now we pump about 450,000 liters of water per day. It's being distributed in tankers to IDP camps throughout town, around town. We managed to get water quality sufficient enough to be able to chlorinate. So all the tankers leaving this plant are now being chlorinated and produce safe drinking water.
Following identification of a rapid rise in diarrhea cases in this area, it was decided that we needed to set up a diarrhea treatment centre. Acute watery diarrhea causes the patient to become dehydrated. So most often we have patients attending the centre who are showing signs of lethargy and sometimes unconsciousness. We rehydrate the patients. So this may be either orally with ORS, oral rehydration salts, or if the patient is more severe, we will provide intravenous fluid administration.
We live inside a tent. Recently I heard about MSF, so I brought my child here for treatment. The hospital was full when we arrived. My child kept vomiting and had diarrhea. As we were poor and they were treating everyone for free, we came here. When he's cured, I will come back to my tent and I'll wash him with soap and water. The doctor who cured him told me, "You'll be able to go back, but you'll have to work on good hygiene. You should clean everything. The more, the better."
Certainly the best way for us to improve the situation is to provide clean drinking water and at the same time make sure that people have got early access to treatment. Health education is also a priority for us. We have health educators here in the DTC and also out in the community promoting the practices of safe hygiene and fresh water drinking.
Two persons came to us and they told us about medicines. They told us about diarrhea and vomiting, and they told us that if you have any patient who is in a serious state, you can take him to a mobile clinic where doctors are available and can treat him. They told us that if you're making any food, you must keep the food away from flies, and that you must keep yourself and your surroundings as clean as you can, because if not, diseases will spread.
The community outreach activities have started in the middle of August. Now, a few weeks later, we have seen a positive impact on the population. One of the main work of the community workers are to deliver health promotion messages, which range from hand washing before and after eating, helping the children wash their hands as often as possible, using the latrines, how to use the latrines if possible, and making an effort to actually go to the water points for safe drinking water.
People are now coming back from other towns to come closer to their homes so that they can see what is remaining and possibly to start reconstructing their lives again.